All right, I'm going to make a start. In the spirit of reconciliation, I acknowledge the traditional owners of the land on which we meet today all over the country. I'm on the land of the Cabrogal clan of the Darug Nation. I also acknowledge that this land was accessed by peoples of the Dharawal and Darug nations, and I pay my respect to their elders, both past, present and future, for they hold the memories, the culture, dreams of Aboriginal and Torres Strait Islander people. I recognise and respect their continued relationship and connections to land, water and culture. I also acknowledge the Uluru Statement of the Heart. It is a statement from the heart that humbly remains an open invitation to support closing the gap. I recognise also those with lived and living experience of mental health challenges, their advocates and allies. I also extend my empathy and respect to those who remain private and silent about their mental health challenges and or experiences. Your experience continues to inform the work that we do. For those of you I haven't met, my name is Evelini Tadros and I'm the CEO for the Mental Health Coordinating Council. And it's a delight to be with you and have you in on this webinar today. The new systems of supports are currently being developed by the Australian Government and the National Disability Insurance Agency in response to the NDIS review for the NDIS review's final report recommendations. This member briefing will provide an update on the current development of foundational supports, where there's a lot of activity happening at the moment for people outside the NDIS, and early intervention supports for people with psychosocial support needs. In addition, members will also receive an update on the SCHADS award, which is the Social Community Home Care and Disability Services Award, and the review that's currently being undertaken in that space. I'm delighted that we have a number of key speakers today, and I will introduce them each as they begin to speak, but just so that we're aware of who's on the call in terms of our guest speakers. We've got Matthew Barden, who's the Director for Disability Policy and Reform for New South Wales Department of Communities and Justice. We've got Vincent Ponzio, who's the Director for Disability and Social Policy with the Mental Health Branch in the New South Wales Ministry of Health. Jerry Norton, the Strategic Advisor, Mental Health and Psychosocial Disability for the National Disability Insurance Agency, and will be joined later by Angus McFarland, who is the Secretary for the Australian Services Union in the New South Wales and ACT. So without further ado, I am going to hand over to Matthew Barden. As I said, he's from DCJ, to start with the presentation around foundational supports. Thank you for joining, Matthew, and over to you.
Thanks very much, Evelini. Hello, everybody. I'd like to acknowledge I'm also on Darug country, on the land and waters of the Barramadigal people, and pay my respects to elders past, present and emerging. As Evelini just said, my name is Matt Barden. I'm from the Department of Communities and Justice in the New South Wales Government. A lot of the work that I'm going to be sort of outlining for you is national work and genuinely national work. New South Wales, and as a disability official through DCJ, are part of that work, but there is also a lot that is being done by the Commonwealth Department of Social Services, the National Disability Insurance Agency and the Commission, as well as all of my colleagues across other states and territories, including through central agencies, health and education. So there are a lot of people working on this across governments to try and progress what was quite a significant reform agenda set out by the NDIS review around this time last year. Just as a bit of a recap, you may well recall that back in December 2023, National Cabinet agreed to design foundational supports for people with disability as part of an initial response to that NDIS review, which recommended that foundational supports should operate as part of an ecosystem of disability supports, which would include our mainstream services, foundational supports, and the NDIS. I'll just note that the foundational supports work is also happening alongside work to implement the Commonwealth's changes to the NDIS legislation, and I'll be talking a little bit about how those priorities align. As I said, we're working very closely with the Commonwealth on how we sequence those two parallel pieces of work, because they're really interrelated and important. So just as an overview of what the current priorities are in this disability reform space, I know that you will have a particular interest in the supports for people with psychosocial disability. Right now, the priorities that I would highlight are providing a joint national response to the NDIS review recommendations. So through the Disability Reform Ministerial Council, which is composed of Ministers Shorten and Rishworth at a national level and all state and territory disability ministers. They've made public commitments to respond to the NDIS review's recommendations by the end of this year. We're currently working across governments to finalise what that response might look like. You will recall that there are specific recommendations in the NDIS review related to psychosocial disability. I can't really talk to where those are going to land until that response is finalised, but as I said, ministers have committed to working towards that before the end of this year, so you should expect to be able to see something soon. One of the other priorities, which I've already alluded to, is progressing the development of new NDIS rules. You'll know that the Commonwealth passed amendments to the NDIS legislation earlier in the year. The way that the NDIS operates is sort of under its legislation and also under a number of rules and legislative instruments. The rules are really part of our co-governance as states and territories with the Commonwealth of how the NDIS operates, in recognition that we're also co-contributors to the scheme financially. There's quite a number of new rules or amendments to rules that need to occur that arise from those legislative amendments from earlier in the year. And a lot of those do require states and territories to agree. So you may likely have already seen the interim Section 10 rule, which is the rule that describes what are and are not going to be considered NDIS supports. There is also a permanent rule, which is still to be made, but that interim rule was required for the legislation to operate correctly from a few months ago when it first started. I can't remember the exact date. There is also now on the DSS website, and I'll provide a couple of links through Evelini as well, to a draft, what is called Section 44.5 rule. So that is one of the powers under the new or amended legislation around how the NDIA might make decisions about whether or not a person, that there are risks about a particular person managing an NDIS plan. And there are a couple of other rules that are still to be made. Many of those are around things like plan management, budget setting, and scheme eligibility. And as I said, that is important that all of that work is happening alongside the work that we're doing to consider how foundational supports will work. And so from a disability officials perspective, all governments are very closely involved in both of those pieces of work. And then the third priority I just wanted to highlight in this space is obviously the overall approach to foundational supports. So you might recall that the NDIS review sort of suggested a number of things could fit within that foundational supports envelope. The exact scope of what foundational supports will and won't be, and what of those services it will encapsulate, is really still to be finalised. It's being negotiated. But what I can say is that work is also being supported by a national consultation that's occurring right now. So the Commonwealth Department of Social Services is leading that national consultation piece with the social deck. That kicked off back in September and runs, I think, another week or bit through to 5 December. And there's two current areas of focus in that national consultation. So one is on the general supports. So I think Vince will talk a little bit more about this in his slides, but basically the NDIS review recommended that foundational supports would include general supports, which are things like information, peer supports, and capacity building. So think very much of like the information linkages and capacity building, the ILC type supports, but not necessarily that model of a program. And then also the targeted foundational supports, which the NDIS review identified a need for targeted foundational supports for people with psychosocial disability. The current focus of national consultation, though, is on both general and targeted supports for children under 9 with developmental concern, delay and or disability, and their families, carers and kin. So those are the 3 current priorities that sit in this sort of NDIS foundational supports space. I will just note that there is obviously another significant priority across all governments, which is the work arising from the Disability Royal Commission, which all governments provided initial responses to earlier this year. So I can let you know that disability ministers have also committed to an interim progress update from all governments on that work before the end of the year, and that the formal biannual, so twice yearly, progress reporting that all governments have committed to will commence from about March to May next year. So there will be transparency about how all governments are progressing each of those recommendations. And so back to foundational supports.
Sorry, I think we might have someone not on mute. If you can mute yourself, that would be lovely. Sorry, Matthew.
No, not at all. So while governments are working to agree the overall approach to foundational supports, there isn't a lot of more detail that I can really go into here about what they'll look like or how they'll be phased or what will be in or out or how it will interact with the NDIS. These are all questions that we're really deeply engaged with and very happy to hear ideas about. But what I can say is that obviously an approach to targeted foundational supports for people with psychosocial disability is something that we would be looking to engage the sector and people with lived experience on at the appropriate time. That hasn't started yet. So please don't feel like work is progressing in detail there that you're not engaged in. But it is definitely on our radar as a piece that needs to be progressed. The current consultation on general supports that I mentioned does include scope for enhancing general foundational supports for people with psychosocial disabilities. So if there are ideas that you have on how those sort of information, peer supports, capacity building type general supports could be enhanced to better support people with psychosocial disability, please do share those through that national consultation process. I'm also happy to take any of those on board through the Q&A. And then the other thing that I would say is that the consultation and design work has really been progressing with a focus on supports for children. And that has so far included broad public consultation sessions, as well as there's been a number of targeted discussions with service providers and families, including families from First Nations and CALD backgrounds. So there's sort of the public consultation, which is up on that Department of Social Services site, but there have also been some more targeted consultations that might not be immediately obvious because they've been sort of for specific populations and groups. And really, we hope to be able to share a lot more information soon about how governments are going to approach foundational supports. A lot of this is, it's sort of coming to a head towards the end of this year, but I can't give you a firm date on sort of when to expect that next sort of announcement from governments. But I think that's probably the overview I'm able to give right now, Evelina.
Thank you, Matthew. And I know I can see some questions coming in, so please do keep them coming in and we'll get to them at the Q&A panel. And I also just recognise, Matthew, that DSS have also got a foundational supports webinar that's reflecting on what they've heard so far. I'll try and include the link to that. That's happening this Friday, the the 29th of November from 12 p.m. to 1:30. So everything they've heard about to date will be re-represented. So I'll include a link in that shortly. But before I do that, I'm now delighted to reintroduce Vincent Ponzio, who's the the Director for Disability and Social Policy. I've just given you a promotion, Vince. I think you deserve one. Mental Health Branch, New South Wales Ministry of Health. And I'll hand over to you, Vince.
Thank you. Can everyone hear me and see me okay?
Can hear you, can see you, and I'll let you know when I can see your presentation.
Okay,
It's
here we
coming up.
go.
Perfect. Thanks, Vince.
Now, I'm just going to check. Nim, are you going to show these slides for me? Which would be very kind of you.
Yeah, I've got it.
Beautiful. Thank you. I don't want to test my technical skills in any way. Thank you. Good morning, everybody. It's lovely to be part of this forum today. I just wanted to start by saying I'm on the lands of the Camaragal people this morning. I'd like to pay my respects to elders past, present and emerging. I'd also like to pay my respects to the traditional custodians of the lands from which you're all joining the call today, and add my acknowledgement of people with lived experience of mental illness, as well as everybody who works with them. So again, thank you for the opportunity to talk to you today, and thank you to Matt for providing that those initial comments, and I'll be sort of building on those from a psychosocial perspective. Thank you. So with the first slide up, so as Matthew said, the NDIS review recommendations, the NDIS review report was released in December of 2023. I'm just going to have to cough. Excuse me. And amongst its recommendations, I guess key to this discussion is really calling out the fact that the NDIS and the broader mental health system have to work much more effectively together. And obviously there are responsibilities on both the schemes side and the NDIA, as well as the mental health system more broadly. There were some specific recommendations made around the NDIS approach to working with people with psychosocial disability. And the NDIS were called to take a different approach to eligibility, planning and review, because it was recognised that a lot of the experience people were having were quite traumatising and non-inclusive. It was felt that the scheme wasn't particularly responsive to working with people with psychosocial disability, particularly the episodic nature, the fact that people will have episodes and then be well and then have another episode, etc., as well as that potential for recovery. So there were, it was seen as that there was a mismatch between some of the processes involved in applying and being found eligible and plan reviews, etc., and the whole process of having a psychosocial disability, particularly that focus on recovery. Part of the other recommendations and findings were that the NDIS could do better in terms of stewarding the market to deliver that sort of recovery-focused approach. There was a recognition that particularly for people with multiple and complex needs, there was a dearth of really specialised providers. So there was a very disparate array of providers, many of whom said they could do and work with a whole range of people, but it was found that they, with time, that people were having lots of challenges in working with people with psychosocial disability, particularly where they had lots of, as I say, complex and comorbid needs. So one of the things that was called out, and one of the really positive things that the NDIA has done, is work in a co-designed fashion and to co-produce the NDIS Psychosocial Disability Recovery Oriented Framework. And the review made particular mention of that and the need to really build on that as an excellent document. So that'll, we'll come back to that as we go through this presentation. Now, if I could have the next slide, please. Thank you very much. So, as Matthew again said, the NDIS review recommended a complete redesign of the disability support system. And that included the design of a foundational support system to really look at providing an alternative outside the scheme and to really build the supports available to people who weren't in the NDIS, in recognition of the fact that we had to look at the NDIS as for people with the highest level of need. And for the vast majority, that will mean that their needs need to be met elsewhere by the states and territories, for example. And so this is foundational supports was a key to that. And we'll talk more about what foundational supports are. Matt's already sort of introduced that as well. Apart from that, there was sort of the NDIS review recommended changes, as I said, to the participant pathway, to the way eligibility was determined, the way budgets are planned, plan reviews, the whole range of things. And importantly, the NDIS review recommended that people entered the scheme through an early intervention pathway before disability pathway. So that's the focus of Jerry's presentation. He'll follow my presentation. And as you'll see, it's envisaged that the majority of participants entering the scheme will be entering via this early intervention pathway. And so we'll all look forward to Jerry's talk around that. In terms of governance, there was a call to reform how the scheme is governed and how funding arrangements and cross-jurisdictional issues are managed. And we all agree that we could do much better across states, territories, and the federal government, as well as the agency, in approaching that challenge. So next slide. Thank you. So just sort of taking that to a sort of finer level of detail. So in terms of this redesigned disability support system, there were 3 overlapping levels. So at the individual support level, that would continue to be funded by the NDIS, that they'd continue to meet reasonable and necessary support needs of people with disability, including, as I say, a much more robust and transparent system of determining eligibility, and clarity over what the rules are for determining that eligibility and providing supports under the scheme. Foundational supports were a key recommendation of the review. As Matt's already said, and people are aware, there are 2 types of foundational supports proposed. One is around general foundational supports that would be available to sort of all disability groups. And they would include things like information and advice, individual and family capacity building, peer support, self-advocacy, and disability employment supports. The targeted foundational supports are for particular cohorts of people. So in our case, we're particularly interested in targeted foundational supports for people with psychosocial disability. This would be for people under the age of 65. They would be non-clinical, and they would be low-intensity supports that would be aiming at supporting people's independence, daily living, community participation. Again, for our purposes, we're particularly interested in people with psychosocial disability and the psychosocial supports that would be part of that targeted foundational support provision. And beyond that, I'll show another schematic in the next slide, but beyond that, there would be mainstream services and community supports, which would be available to all Australians. And they include things like access to hospitals, schools, public transport, public housing and policing. So that's further explained on the next slide. So this next slide really is a schematic that seeks to emphasize the integration that's needed across the systems. So the larger pyramid on the left-hand side is really representing the disability system, the disability support system. So as we've just described, mainstream services are the base of the pyramid, available to all, then general foundational supports that are available to all disability groups, targeted foundational supports for particular cohorts, people with psychosocial disability, as I say, are a particular focus. Then there would be the early intervention pathway through the NDIS, and then the disability pathway, the individual packages available through the NDIS, which people are familiar with. So that's sort of set side by side by the mental health system that we've represented on the right. So it takes in non-acute community-based services, more intensive sort of assertive outreach services that are available in the community, as well as inpatient mental health services. So as I say, the real thrust of the challenge in front of us is to integrate the disability systems and the mental health system in a way that provides the best outcomes for individuals and their families. And some of the key components of that are listed there. So we're looking at integration, we're looking at fairness and equity of access, transparency, true partnerships in many senses of the word, both, look, very sort of front and center is between, the federal government and the states and territories and the scheme. And that goes for shared decision-making as well. We're obviously looking at shared decision-making at very many different levels. We spend so much time arguing about what the responsibility is of one system or another, and to have much more of a shared understanding and a shared stake in decision-making about, for example, who gets in the scheme, who is diverted into foundational supports, etc., would be a huge step forward. The importance of locally oriented plans, the importance of the peer workforce, and having, as I say, more along the lines of having standard agreement, so that we're not arguing over referral, patient tools, reporting metrics, a whole range of things that we need to agree on so that we can move ahead and focus on the things that are important, and that's the needs of individuals and their families and getting it right. Okay, so one of the things I wanted to emphasize was looking at the way the system is governed across disability and mental health. So one of the things that we've been keen to do is to ensure that the work that's happening around, for example, the unmet needs analysis in psychosocial support needs. So there's been a Commonwealth piece of work as well as a state piece of work. Commonwealth piece of work has been publicly released in around August of this year. And it's an important document that looks at unmet needs in terms of psychosocial supports across the states and territories. It looks at what is provided by what tier of government. It looks at the people who need psychosocial supports but aren't currently receiving those supports for various reasons. And that Commonwealth piece of work was really overseen by a group called the Psychosocial Project Group. And that Psychosocial Project Group sat under a senior mental health officers group called the National Mental Health and Suicide Prevention Senior Officers Group. That group is really auspiced under the agreement, as is written there. So MHIPSO, as we call it, is we're looking to really convert that into a forum where we can try and better integrate what's happening across psychosocial supports and across foundational supports. And as Matt said, we're waiting on some key agreements to happen, and I'll get to that in the next slide as well. But what we're wanting to do is to ensure that the planning is as integrated as possible. Obviously, the ideal is to plan in tandem across the psychosocial support unmet needs analysis, across the foundational supports for people with psychosocial disability, across the early intervention pathway. So we wanted to bring all these things in so that we're not planning in isolation, but we're planning in an integrated way, in an iterative way. And we've still got a way to achieve that, but that's the intention. If we go to the next slide. Okay, so the next slide basically is some of the documents that you're very familiar with, and it really talks about what we really wanted to emphasize here is the fact that we are very much aware of people's advocacy and people's great and understandable interest in the next steps involved in the process. So Matt's described the fact that governments still need to reach agreement, and those when agreements are reached, those decisions will be announced, and we're not quite sure of the timing of that. I'm sure that'll come up in some of the questions. But we are very much looking forward from a New South Wales point of view, from a New South Wales mental health point of view, to working with you all around this. We're looking for the first available opportunity to do that. It's overdue, and we're sorry about that, I think, but we're all very keen to engage with you as much as possible in terms of working with people with lived experience, but also working with a whole range of stakeholders in co-designing a process that will incorporate looking at foundational supports for people with psychosocial disability. So we're very aware of stakeholders' submissions that have occurred, the excellent advice that's been put together. We've got, we're not starting from a blank slate. We've got a lot of experience to call on and a lot of great partnerships. And we're looking forward to, as I say, working with the sector in taking those next steps. That's it for me.
Sorry, I was so engrossed in the presentation that I completely forgot where my mute button was. Thank you very much, Vince. I think you were able to take us back a step in order to help us move forward by giving us all that background information and also understanding how it intersects with the so many other, I keep calling it, the inquiry after inquiry and the review after each review. So just how it intersects with other reviews, and the schematic was really helpful to try and understand how it all fits in. So thank you very much. Over now to my dear colleague, Jerry Norton, as I said before, is a strategic advisor for mental health and psychosocial disability for the National Disability Insurance Agency. Thank you, Jerry, for your time, and over to you.
Thanks, Evelyn. Good morning, everybody. I'm joining you from Melbourne on the lands of the Wurundjeri people of the Kulin Nation, and pay my respects to elders past, present and emerging, and those who might be with us today. I also acknowledge the lived experience of participants in the scheme with psychosocial disability and their family carers and kin. In my talk this morning, I'm wanting to really focus on two areas. The first was to give you a quick update in relation to the functioning of the NDIS in New South Wales, and give you some quick stats and outcome performance figures, just to a quick update. And then to Evelyn and team have asked me then to talk a bit about some of the emerging thinking on what we're calling an early intervention pathway, but we'll come back to that in a moment. Next slide, please. So just a quick snapshot about where we're up to. In the year 2023-24, that's the financial year, the NDIS spent $1.76 billion. That's actual payments to providers. In addition to that, through our planned budgets, there was an additional $450 million. So what we call our committed annual supports, our CAS, was $2.2 billion. So one of the points I want to make here is the significance now of that investment in both New South Wales and nationally. As at 30th of June, we have 19,029 participants within the scheme. We have had essentially 32,000 since the scheme started access requests, with 66% of those being accepted and 34% not meeting access requirements. I think, as Vince has highlighted in the NDIS reviews recommendation, one of the key challenges we do have is clarifying what is the scope of responsibility for the NDIS and what is the scope of other support systems. I think, as both Matt and Vince have highlighted, we are seeing a very significant shift in the way in which all governments are thinking about the NDIS and our respective responsibilities. For many years, the focus has been about getting as many people into the NDIS as possible, both at a state and territory and within the, some Commonwealth areas. We're now starting to see a much greater discussion about a more connected, integrated system, and which I think is a really positive thing. And I would agree with Matt and Vince's comments that I think we're working much more together than we have historically in trying to sort through what those things might mean. So when we look at, I wanted to just focus a minute around the other issue is to try and understand what's actually happening. So if we look at the last 12 months, that is the 23-24 financial year, we had 1,875 people applied to the scheme, 952 were accepted, and 923 not accepted. So the point there, and the point you'll see if anybody looks at their annual financial services report, the NDIA AFSR report, what we are seeing overall in the country is the numbers of referrals coming in is reducing. And I'll come back to this a bit more when I talk about early intervention. But there's a whole set of questions, I think, around the way in which our access process is working, people who should be in who are not applying, or are disengaged from our bureaucratic processes. That's, I think, one of the important issues as we go forward. But the point I'm drawing out here is we are seeing in New South Wales, as in other states and territories, numbers of people applying drop. What's interesting is the 2011 PC report talked about 57,500 people likely to meet the severe and permanent eligibility criteria. We updated that to 64,000. And essentially in 23-24 was just under 64,000 people with psychosocial disability within the scheme. So some really interesting issues in regards to that. The unmet needs report, psychosocial disability needs report, I think is very insightful in many ways. One of the details I suppose find particularly interesting is in terms of the numbers of people on psychosocial disability schemes within the country. The NDIA is now providing a support for just over 50% of those. And so there's this interesting discussion about what is the proportion as we move forward of the population with severe mental health issues and psychosocial disability issues that should be supported through the scheme. And I think, as Vince is saying, that's one of the issues we're all keen to seek clarification on. And I certainly will be, I think you can look forward to, I think, a range of discussions on that over the next 12 to 18 months. The last a bit of information on this slide is the average participant budget is 116,341. Next slide, please. This slide, next slide, when it comes up, just really talks about some of the outcomes within the NDIS of people with, specifically with psychosocial disability. And in each of these four areas, you'll see New South Wales is faring above the rest of the country, with the exception of family carer employment rates. So in terms of employment rate in New South Wales, the number of people within the scheme who are employed is higher than any other state in the country. In terms of, again, community and social participation, New South Wales is significantly higher than the national average and is leading all other states. And again, in terms of participants' perception of whether the NDIS has been helpful in regard to more choice and control, New South Wales is above the national average. In terms of family care employment rates, again, it's slightly below the national average. So in terms of outcome data, there's clearly some very clear data that New South Wales is doing well in regard to some of those outcome indicators. Next slide, please. This next point I wanted to make is one of the significant issues now I think we're seeing is the extent in which government investment in psychosocial disability in the country is of major significance. So my best projections of the figures from our work and the projections from the unmet needs, psychosocial unmet needs data analysis is that we are, in Australia, there is a commitment of about $5.8 billion to psychosocial needs across all governments, all Commonwealth, state and territory governments. I think when we look at that, that amount is around 45% of the projected combined government expenditure in mental illness in Australia of $12 billion. And I think, again, part of this broader discussion is the need to stop and say, given now the significance of that investment and the future growth around foundational supports for psychosocial disability, how do we start to better understand how these systems need to work together? And that's, I think, a real shift in attitude in regards to this. There is so much more discussion now about and I think Vince has talked about a number of these words, integrated, coordinated, connected, collaborative approaches that I think are so important in the way in which these discussions are going to be framed. I draw a lot of optimism about that because it's not always been the case. And I think, from my perspective, it will be one of the important defining issues over the next 2 years about how we take this time to get the design of this new system right. And one of the important issues is, I think the NDIS review's critique was, we've not got that right in the first decade, and it's critical to make sure we set the grounding for it being a much better system and utilising available resources, which are now significant, in a much more effective way. Next slide, please. So just moving on, what I'm wanting to talk now is some of what I'm calling emerging thinking. So I think, as Matt's outlined, at this stage, there's still governments across the country are finalising their position into the NDIS review's recommendation. The agency has been keen to try and progress some of the work on an early intervention pathway. And so I'm wanting to share quickly some of the thinking that is emerging. Next slide, please. So we've worked through the National Mental Health Reference Group, which is our national advisory group, and Vince is a member of that group and plays a very prominent role in that group. I've set up a co-design working group, which has strong lived experience, provider and health professional representation. So just quickly, what's the problems an early intervention pathway is trying to deal with? One is the slow take-up of planned budgets in the first 2 years in scheme. Many people don't know exactly what they want, and it takes them some time to understand that. The second, I think, concept is the lack of a planned approach to introducing participants to how the scheme can support them, the supports the NDIS can and can't fund, particularly under the new Section 10 interim lists. How other participants have used supports funded by NDIS to address their goals. That is, how we can help people to understand how other participants have found things effective in building a contributing life, in managing their budget and achieving their goals. We do know that there is, I think, some significant problems in the marketplace in accessing skilled support coordinators and a lack of confidence resulting in new participants not being linking people into housing, mental health and health services, identifying employment and education opportunities. So a real sense of how do we make sure that support coordination is doing more recovery orientated activities and not only putting people on waiting lists for house cleaning or transport or social companionship services, which much of our effort is currently going on. The next element, I suppose, is, and the feedback, it takes time and many people need supports in building trusting relationships, and that at the moment some of the sort of speed of setting up plans or specifying goals is not helping people in their own way, their own confidence about how they use their budget and their plan. I think another important criteria is 60% of people now entering the scheme have not received psychosocial supports outside the NDIS. Many who were historically coming through public sector mental health and NGO services are now coming through general practice and often are not being referred to other non-NDIS psychosocial support services prior to coming into the scheme. And the other one is the need for good information and reliable advice to avoid provider capture. Next slide, please. So what's our thinking about the aims? So just quickly, to better engage, educate and empower new participants in how they understand and develop their plan, manage their plan budget, and select, use and manage the supports that will work for them. To offer information and advice to participants about their options and support their decision making. And that's particularly important given the new legislation and the greater flexibility that will be provided to participants and their role rather than our scheme planners in deciding which options they wish to use in their plan, and to better support participants to live with and better manage their severe psychosocial disabilities. Next slide, please. So quickly, I think important to say, the concept of early intervention is really early in scheme. Many people comment about this is not a life stage thing, and that's correct. But we've used section 25 to say it is about early in scheme. We see the majority of new participants entering under section 25, although many will be eligible under section 24. We're proposing we might call a stated support, an early intervention. We're thinking is at the moment is that would be a stated support and offered for a 1 to 3 year period based on the person's preferences and needs. We're suggesting an early intervention service would include some structured program elements, the importance of onboarding, information and education, selection of support coordinators, focusing on short and medium-term goals in improving functional capacity. The importance of getting to know the participant, their history, their life aspirations and barriers in developing both plan and plan budgets. The other element is the notion that's being explored is very difficult. One of the big critiques is it's very difficult to provide a comprehensive plan within 28 days for people with psychosocial disabilities, and the need for a longer period of time, perhaps up to 6, maybe even longer, before a more formal plan would be finalised and approved. Other elements would be commissioned service providers. Again, this was one of the recommendations of the NDIS review. And I think important focus on monitoring of outcomes for participants from a participant perspective, what's working for them, and from a scheme perspective. Next slide, please. So I won't go through this, but what this slide tries to do is really talk about phases in an early intervention program, phases of development. And you'll see we're really breaking these down into an entry phase and then subsequent 12-month periods. So the notion of a psychosocial participation plan is a concept we've got, but important decision-making points over that first 24 months. And then really that point of next steps. One of the issues here is depending on how the whole new system pans out, the opportunities to provide access to non-NDIS psychosocial supports. But certainly from our perspective, the need to have both warm handovers to Section 24, where people would be continuing in the scheme, rather than having to go through retesting of eligibility, and no exits to the scheme without support, which I think is a strong principle of the work that we're doing at the moment. Next slide, please. So just this last slide, I think just to perhaps summarise some points I'm making about other elements of psychosocial reform that will be integral to what happens in early intervention. Clearer guidelines on access criteria and evidence of psychosocial disability. Again, I think re-emphasising, and I was very pleased that Vince made this point, that the psychosocial recovery-oriented framework is a document that was developed with intense consultation, and I think there's a need to implement many of the aspects of that framework. And the final point is, in our work, we are having, I think, a strong focus on co-design and input to the development of this early intervention pathway to deal with ensuring that all the voices can be heard in relation to the development of this model. So I'll stop there. Thank you, Evelyn.
Thank you so much, Jerry. Always full of so much information and wisdom and experience to share. So we really appreciate you taking the time. And everyone has agreed to, all the speakers have agreed to share their slides. I'm going to take a bit of a executive decision, but I'm hoping that Matthew, Jerry and Vince, you can stay with us. Angus has now joined the line. Are you both, the three of you, available to stay until Angus does his presentation? Then I'll just open it up for Q&A to everyone. I've got a yes from Jerry. Vince, have I got a yes from you? Fantastic. Matthew, are you okay to hang around?
Yeah,
excellent. In that case, I'll just go to the next and final speaker for today. Thank you, Angus, for joining us a little bit earlier. Angus is the Secretary for the Australian Services Union for New South Wales and ACT, and he's going to present on the SCHADS review. Over to you, Angus. Thank you.
Hi, everyone. Thanks for having me here today. So I'm just joining you from RMIT in Melbourne, where I found a little room to speak to you about. Hopefully there won't be too much background noise. I'm at a conference here today, but I really wanted to spend the time to brief you all on the SCHADS award that's being reviewed at the moment and the applications by the ASU to update the classification system. For those who aren't aware, the ASU is the union in New South Wales for the community mental health sector and the NDIS and the broader community services industry. And so we have a long history with the SCHADS award being the main award for our industry and for all of your services. And we were proud to be part of lifting the SCHADS pay rates back in 2012, which I'm sure many of you were also a part of and will remember, where the pay rates in SCHADS lifted between 23 to 45%. And there was, of course, supplementary ERO funding, as it was referred to, between 2012 and 2020 to accommodate the phase-in of those higher pay rates. But one of the issues that we have seen and heard loud and clear from our members and also from employers is that the award doesn't provide adequate pathways for practitioners to progress in their pay. It doesn't provide for recognition of experience, qualifications, skills, and complexity. And that leads to real divergence in how people are paid. It can lead to people, your most experienced, best workers capping out very quickly within a level, and the only option for them for pay progression is to go into management roles. And we certainly need great managers, but we also want to be able to keep our best frontline workers at the front line as well, and that to be an option for them. So the ASU put an application to Fair Work to basically review and update the classification descriptors in SCHADS. The SCHADS descriptors were actually written in the 1990s, so they are quite a bit out of date, and there's a lot that if you look at them, I'm sure many of you have, that could do with updating to recognise the work that's happening today, the contemporary expectation of work. We know that funding bodies, regulators, a lot has changed. There's a lot more expectation on what you and our members are doing in community mental health services, and we want that to be better recognised in the award. So we put that in July. The Fair Work Commission itself also has decided to review SCHADS because it has new powers now where it can unilaterally review an award, which are new powers that were given to it by the new, not so new anymore, by the federal government. So what it decided to do was to merge its review and the ASU's application into one process. And it's got a couple of stages to it. The first stage will actually be held this year in just literally next week. And that is to deal with a threshold issue about who is on the award or isn't. And it's one that we have concerns around in the NDIS. It's mainly in disability services. And that will be to clarify, from our point of view, that everyone in the NDIS is covered by the SCHADS award. They're not home care workers or other award workers. So the Commission is going to have to make a threshold decision on that first, and we expect the decision on that will come down in March or February, March. And then they'll get on with the broader work of then updating the SCHADS classifications, and we expect that would start soon after then. We know this will be a process that will take some time, as it should, because we want it to be collaborative and consultative, and the sectors that are represented on SCHADS are really diverse. We're also not naive. We understand that this is something that fundamentally will need to have the support of government and funding bodies, state and federal. So we're not just running off to Fair Work to do this and then at the end of that process planning to turn around and say, hey, government, what do you think about this? What are you going to do about it? We've already launched a big community campaign called the Skilled, Respected, Equal campaign. It launched just a few weeks ago. We had a national week of action. We had a whole lot of employers and peak bodies coming out and supporting what we're doing with the SCHADS review. And we've already started talking to politicians and governments, and obviously with the federal election around the corner, we want to make it a big focus of that as well. So we're starting the community campaign work as well as obviously the Fair Work process. So I just wanted to, basically that's sort of the update I'll give for now, Evelyn, and I'm really happy to take further questions or talk to anyone else offline or separately later. I know I've spoken to some of your members directly, some of the big providers. I'm happy to talk to anyone else to find out more information about it, because we know that through working together as an industry, we'll be able to, get hopefully the best outcome possible for the sector.
Wonderful. Thank you, Angus, and thank you for stepping out of the conference to present a bit earlier. Can I have all the panelists come back online? And what we might do now is go to some Q&A. I'm welcoming everyone to come on camera, all our participants and our guests. And if you can start by putting your hand up, I obviously have some questions in the chat as well. So I'll manage and saddle both the hands up virtually as well as just use the hands up function. It's under the heart react. Down the bottom, it's changed if you haven't used Zoom for a while. So bear with me while I do go back to the top of the questions. I think, Claire, would you like to ask your question live or would you like me to ask it? If you don't come off camera or come on camera. Oh, I can see movement. Hi, Claire, go ahead. Yes, I can. Thank you.
So in the original media release, which came out all the way back in January, it said that the foundational support strategy was going to go to National Cabinet before the end of this year, presumably for discussion. I'm assuming since the consultation's not finishing until next week, that's not really looking particularly likely. At the moment, the roadmap for reform just says that it's happening in the future. Is there any timeline that can be a little bit more specific?
I can take that one.
Thanks.
Thanks. Look, it's a really fair question. I don't have a date for National Cabinet to consider the sort of next steps on foundational supports at this time. It's sort of a matter for the PM and premiers and so forth to agree the date. But we're certainly working towards, when they do meet, having the information available to make the decision and then communicate that to everybody.
Thanks, Matthew. Thanks, Claire, for the question. Paula, I might actually ask people if when you ask your question, if you can just state your name and the organisation that you're attached to, that'd be great. Paula, are you comfortable asking your question live?
Yeah, hi, I'm Paula Hanlon. I'm a peer worker based in a community mental health service in Sydney. I had a couple of issues. I raised the issue about the connection between physical health and mental health, that they're so connected. After 40 years of psychiatric medications, and I'm still taking a lot of antipsychotic medication every night, and the weight gain, the weight loss is a constant battle. And I recently got told that my physio was no longer going to be supported, and that's what's been keeping me being able to attend work and my community activities, was having that weekly physio. Somehow I've now got it fortnightly, but the pain I live with because of the situation I'm in is I use a walker to get around, but I still get myself up and get to work each day, and it's not easy. And my voice is a constant, all of that. Sorry, I don't want to go into a big thingy, but I guess my concern is that the connection between our physical health issues as a result of our mental health issues, are they going to be considered in all of this planning? I'm not up currently on everything that I've heard about today, so I need to understand more what's in and what's out and all of that. But I can look that up. But I guess I'd like to hear that there is going to be that consideration.
Paula, your lived experience is so paramount and central to everything that we do day in, day out, and you're not alone in terms of seeing reduction in services being provided under the NDIS and the complexity that the system still exists with. I'm a carer, I'm my mother's nominee, so I understand only too well the complexities associated with it. Matthew, are you best to talk about, I guess we generally, as a peak, are seeing more and more participants with reduced service provision and reassessments and the complexity that comes with that and appeals processes. Is there any advice that you want to give generally, given we are largely, a group of service providers, in terms of the client group that we would be seeing, and the advice that you would have for service providers and participants who are seeing this on the front line?
I don't know that I can answer all of that. I think what I could say is that I kind of described in my intro bit that there is a piece of work that's happening around foundational supports and a piece that's happening around the legislation and the changes that the NDIS, the Commonwealth, is making to how the scheme operates. And we have a really strong focus on keeping those pieces of work connected. And I think Jerry also made a few references to, nobody being exited to no supports. We are really trying to reshape how the whole system works. And as the foundational supports part comes online, there may be some movement about what might be accessible through like an individual funding package in the scheme, and what is more maybe easily accessible in the community. But we haven't gotten there yet. If people are seeing examples of like changes in how the agency is making decisions in a systemic way, we're always happy to and do regularly raise those with the agency. Sometimes they come back and say, actually, that was kind of an individual matter and this is why that's happened. And, we do kind of get into some back and forth. But the Commonwealth has been very open about, if you're seeing changes happen prematurely, tell us about them and we'll get on top of it. The scheme is a big ship that just kind of keeps going, and once it sort of thinks it knows what direction it's going in, it might be a bit hard to get all the, many people who make decisions every day, all making consistent decisions. But yeah, if we're experiencing specific issues, we're always happy to feed those back to the agency.
Thanks, Matthew. So I guess it'll be up to the likes of Debbie Jaggers, who I'm acknowledging is on the line from NDS and us at MHCC to kind of consolidate that feedback in some way, shape or form. Ellie McGrath, I noticed you put a really helpful comment there. Did you want to come off mute and share that more widely?
Hi there, Ellie McGrath. I'm a mental health team lead at Central and Eastern Sydney Primary Health Network. I guess this was just a bit of a comment that I thought of while Jerry was presenting. I guess just hearing that psychosocial access into the NDIS has improved a lot. I guess from our perspective, it's the complete opposite, where our providers used to have a 93% success rate in their application to the NDIA for psychosocial supports for the people that they're supporting. And now, we're not even getting decisions made within the same financial year, waiting 6+ months for any decision that comes through, which a lot of the time is just we need more information. And then we're waiting another 6+ months for any decision based on that information. So I guess it was just more of a comment that things are quite dire in terms of psychosocial supports through the NDIA at the moment. And in particular, I guess, while we're still waiting for any sort of indication or announcement from the department on the future of psychosocial funding, just that things are getting quite dire out there for people. Thanks. Yeah, it was just more of a comment.
Thanks, Ellie. Any comments, Vince, Jerry or Matthew, that either of you would like to make on any of those questions or comments from anyone?
I'm happy to comment on that. I think one of the points I'd make is, in global terms, we've never spent as much and supported as many people. And I think while there's clearly issues about evidence of psychosocial disability, that's the larger picture. I accept exactly, Ellie, your comment. It's been a consistent issue in relation to who's in and who's out for many years. So it's been a long-standing issue. One of the recommendations from the review that I think clearly we're waiting on government's response to is the need for greater clarity about who gets in and what the evidence of severe, persistent and episodic are. And that has been very much an area of confusion. What we are seeing, I think, increasingly is people going through doctors and getting the information that is provided into our assessment process is clinical mental health data, but very little around functional capacity. And clearly the assessment has to go to functional capacity. And that is one of the reasons why I think you are seeing a request for further information, because the information provided is not addressing the evidential requirements. And where that's come through public sector agencies, you're tending to get higher rates of success meeting. So I think, Ali, an interesting question, I think, about how do we work with general practitioners about helping them to understand what the evidential requirements are as well.
Thanks, Jerry. Debbie.
Thank you. So I'm Debbie. I'm the State Manager in New South Wales for NDS. So we're the peak body supporting disability service providers. So thank you for all the updates. They're super helpful. Thank you very much. A couple of comments and then a question. Echoing some of the other attendees and Evelyn, we're certainly getting lots of anecdotal information around people finding it harder to get into the NDIA, or being reviewed and being assessed as no longer eligible, particularly in the children's space. So we're collating that information, and we are sending it back through our channels to NDIA. So that's certainly happening. And I might just put the list of supports as the other one, where there's been a lot of clarification happening around what supports are in and what supports are out. So that was one comment, and certainly as echoed through Jerry and Matthew, certainly our strong view is that there shouldn't be any change in access to the NDIS until foundational supports are in place. You know, as we know, in New South Wales, compared to many other states, we've, in my view, and NDS's view, we've probably got the biggest gap in terms of that foundational support service provision. So we've got a lot of work to do, as echoed by some of the presenters, to ensure people have got integrated services. So that was the first point. I'd like to acknowledge and thank DCJ. We certainly had a very positive experience in dialogue with DCJ around early childhood foundation supports and some of those early conversations from a provider perspective. So that certainly bodes positively around what it could look like for other aspects, such as psychosocial. So thank you to Matthew and others for that. And so my question really is for the psychosocial space, and particularly for New South Wales. So I appreciate, obviously, nothing can go forward publicly until after some of these decisions have been announced. And which department will be leading this work for New South Wales? Thank you.
I think that's my cue.
Go on.
So, like Matt and I work very closely at New South Wales government level. So Matt's department is the lead around the NDIS interface and around the review and around all things NDIS, including foundational supports. And our Cabinet Office also has a key role in working with Matt and the broader sort of government sector. In terms of psychosocial disability, we, mental health branch and within the Ministry of Health, would be the lead around psychosocial disability. But we work really closely with Matt, with the Cabinet Office, with our colleagues within the ministry called Health and Social Policy Branch that have they're the main ministry lead for the NDIS interface. They're leading the work around foundational supports for kids. But mental health branch leads around psychosocial disability, with the proviso that we work in tandem with a whole range of partners. But as I say, we're really keen to work with your organisation, Debbie, and with other organisations to really put a spotlight on this area and take the planning forward. To go back to some of the other issues that have been raised, I certainly respect Jerry's view around the NDIS. I mean, there are lots of reports coming to us about people finding it more and more difficult to access the scheme, and about more and more calls for further evidence, that all treatment options have been exhausted, etc. So people are perceiving this as the NDIS being harder to access and getting into, and the communication not being what it is. The other issue is really around the fact that one of the criticisms that we often hear is about when people have a range of disabilities. And I think Paula, was nice to see you on the line as well. When Paula's talking about sort of a co-occurring physical disability with a mental health disability, the NDIS is really, I mean, one of the things that we're trying to work together with Jerry and other NDIA representatives about is really seeing taking a holistic approach to an individual. So when a person's got disability needs, it can be really difficult to sort of, you know, make a distinction and a differentiation between different disabilities. But it's all in all our minds that we need to really do a better job of responding to people and making it clearer what you know, who's providing what to whom, and so that we can, you know, as I say, we spend a lot of time working out the boundaries between different services and what you know, say, for example, what the state will provide and what the scheme will provide. So if we can reach agreement on those sorts of some of the fundamental issues there, we go a long way to focusing on what we need to focus on, as I said.
Thanks so much, Vince. And thanks, Debbie, for your questions and comments. Corinne.
Oh, hello, everybody, and thanks to all the speakers for your really interesting and useful presentations. Really appreciate it. I just wanted to ask, there were several very well-respected programs, you know, Partners in Recovery, FAMS, that were rolled into the NDIS, which actually meant in the end that a lot of people were left without the supports that they needed. Is there any chance that government might look at those particular programs to be resurrected under that kind of general supports category? Thanks.
Corinne, I'll take that one. Look, absolutely. We're very mindful of when I alluded to people's experience before, that some of those programs that you've mentioned there, the FAMS and Partners in Recovery, have got an excellent evidence base, and they were very well regarded when they were operating. And so, you know, they provide a real template for us going forward. Now, I think, you know, there's still a lack of clarity about what is a general support versus what is a targeted support, etc. So we can have that debate. But the overwhelming answer to your question is absolutely yes. And we are definitely very aware of those programs and all their positive features.
Well, that's lovely news. I'm really pleased to hear that. And I'm sure that I can see Paula is smiling there, because I think you worked in that service yourself, and they were great services. So thank you so much, Vince.
I think you're going to get everyone's support on the line here. I'm just acknowledging Debbie sent a comment saying she led the establishment Partners in Recovery in Hunter. I know that I managed Partners in Recovery and I was with Mission Australia. So there's a number of us who, you know, as you said, it's evidence-based programs, and that is listed in the advice to governments that you referenced before, Vince, from Mental Health Australia. So that's great. Sandra, did you want to come off mute and talk to your comment?
Sure. And just to be transparent, I'm actually based in Victoria, so, and I'm an ex-FAMS worker and still use it to this day. So I guess I'm more speaking from a Victorian point of view, but certainly our psychosocial workforce has been gutted over the last 10 years. So and just looking at all the, you know, the huge changes coming at the workforce, I'm just curious to hear the panel's views about how we're going to develop and build a quality psychosocial workforce, and just around the commissioning process and all the proposed ideas of psychosocial navigators, because my experience is that commissioning processes tend to go to the big players, and really experienced people such as myself who've been around the sector for a long time, we don't even get a look in. So just wondering if anyone has any info on that.
I'm happy to have a start off on that.
Yeah, Jerry, I might just quickly also flag that we've also done a workforce solutions paper on this particular topic. So I can't share screen properly, but hopefully you can see. Have you been able to see my screen? Have I been able to share properly? Nim, could you just help me out? Am I sharing that
Yeah.
screen properly? Okay, so we've done a couple of things in this space as the peak. There is a National Mental Health Workforce Strategy report that was released around April of this year. Unfortunately, it was quite silent on the community managed organisation sector, but we do a profile report and have done so for the last 6 years. We do it every 2 years. And we also came up with a solutions paper earlier in the year, which talks about these 10 key strategies, and we're calling on certainly the New South Wales government, but we do advocate at the Commonwealth level as well to support us in the workforce strategy. We make up a quarter of the mental health workforce in the community managed sector. So none of this is going to come as rocket science, just supporting with workforce recruitment, retention and growth, career promotion pathways, training and education. We are national leaders, if not international leaders, in developing the certificate for peer work and peer work leadership, and more recently peer work navigator, because we're a registered training organisation as well. I mean, we've got Angus on the line. I'm acknowledging Angus has got his phone up, but we're talking about conditions, remuneration and equity, and we want to see it equitable with the private sector. It doesn't matter whether you're in the CMO sector, the private sector or the government sector. If you're doing the same job, there should be equity in the salaries and in the wages that are offered. Systemic challenges and opportunities, which talks a little bit, Sandra, to what you're talking about the smaller groups and organisations not having as much flexibility and robustness around tender writing, etc., to be able to win contestable tenders, and the role of government in bilateral agreements, and we'd also say bipartisan agreements, and standards, regulations and guidelines and quality improvement, and finally data gathering. So I wanted to jump in quickly just to share that we're doing a lot in that space as well. I might go to Angus and then I'll come back to you, Vince, if possible. Angus?
Thanks. Yeah, I think just to say that obviously a part of the puzzle here is the award reform stuff that I talked about, because, if we look at things that have happened just in the last 12 years, since the equal pay case and the last good look at the award, the creation of the NDIS, roles like recovery coaches, navigators, local area coordinators, support coordinators, a whole heap of things, just the award does not speak to at all. And that can mean that it's difficult for employers, it's difficult for employees, and it's difficult for governments to work out, well, where do we pitch those levels? What is the appropriate pay? What should that be? And often there will be obviously divergent views on that as well. So that's another reason that we're trying to modernise the award, to get that better clarity, but not just clarity, recognition that these new roles are more complex. There are a lot of expectations on this, the workforce to be working much more independently at a higher skill level and with more both generalist and specialist kind of skill sets.
Thank you so much, Angus. And so I think it was Jerry who wanted to jump in and say something about workforce. Jerry, over to you.
I think Angus has probably said all that I was going to say. I think it's very well put in terms of the sort of current problems that we do have. Just to say, the NDIS review was clear in the need to improve competencies. And workforce issues have been a long-standing issue in regards to this. One point I just wanted to draw out was under the legislative changes, there will be greater scope and flexibility under the flexible component in plans to people to be able to choose higher levels of higher skilled and higher remunerated supports than has been the case in the past. So I think that's another area to have a look at as the new legislation rolls out and the new framework. People need to be in the new framework to actually access those opportunities.
Thanks, Jerry. Very helpful. And we obviously need to stay and keep our finger on the pulse in terms of the National Mental Health Workforce Strategy Implementation Group. And I know I've put in an expression of interest to join that group. So we'll see where that lands. That application went in April and it's still being worked through. Let's just say that. It's now November, just saying. Any other questions or comments that anyone would like to make? Have my guest speakers, Matthew, Jerry and Vince, Angus, would you have any further comments or questions or to the group that you'd like to? Matthew?
Evelina, just on the workforce thing, I might just mention, obviously, workforce is a significant consideration in the design of foundational supports as a whole. While we haven't gotten to a focused discussion on the psychosocial space just yet, we obviously recognise that the way services are delivered has changed significantly with the introduction of the NDIS, and to some extent we're needing to support the sector and the workforce to think about how to deliver those services in a different way. And I think Debbie would probably expect me to mention that there's also work being done to consider sort of the NDIS pricing approach, which IHACPA, so the Independent Health and Aged Care Pricing Authority, is doing around some of the opportunities for a framework for NDIS pricing going forward. And we're also looking at sort of what a regulatory framework would look like, because I know all of those things sort of add to the pressures around workforce as well.
Wonderful. Thank you, Matthew. I'm acknowledging that the questions are slowing down on the chat, and I don't want to hold up anyone unnecessarily. So I'll take this opportunity to thank my guest speakers, Matthew, Angus, Jerry, and Vince. Your time is really appreciated. Your wisdom is appreciated. Mental Health Coordinating Council is here for you to continue to consult and liaise with. Obviously, we have our members here in attendance, and they'll go back to their respective organisations and share this knowledge and input. So please join me in thanking our guest speakers, and I hope that you have a lovely afternoon. Just one last message from my comms team is that we have an annual member survey that we conduct, and we highly encourage you to engage in it. My team are going to put a copy of that survey in the communique or in the chat. So please do engage in that member survey. It only helps inform the work that we need to do over the following 12 months. So thank you very much for attending today. Please click on that link before the Zoom meeting shuts down, because you'll lose that link otherwise. And I hope that you have a lovely afternoon. And if I don't see some of you before the end of the year, I hope that you have a lovely end of year break. For those of you who celebrate Christmas, Merry Christmas, Happy New Year. And I look forward to continuing to work with you. I know that it sounds very early to be saying Merry Christmas, but it is the end of November, and I may not get the chance to say thank you for your support of MHCC throughout the year. That draws the meeting to a close. Thank you very much.